So, hello, morning. My name is Stephen Allerton, and I'm a certified prosthetist orthotist practicing in Ireland. And I've come along with Trulife today to run through some of their stock products. We would be using a range of these products within our practice. We work throughout Ireland in the HSE clinics and private clinics, and we would fit braces and custom-made devices also. Today we're looking at the range of Trulife stock products across a range. The first product is the Lerman Minerva. Now, this is a C2T3 stabilizing brace and is used for degenerative disease, muscular ligament injury, stable fractures, undisplaced fractures. Wouldn't include the C2 odontoid peg fracture that would have to have the halo attachment fitted onto this, because that's the C2 peg at the very top end of the spine and wouldn't be suitable for this brace to stabilise that level. But the good thing about this brace is it's a very easy to fit brace and is highly adjustable for the practitioner, so they can fit a multitude of patients very quickly and easily. The anterior section is adjusted with the screw to get the level of the fitting under the chin in a neutral position. I will be fitting this on the model in a moment, but I'm just showing you basically on myself, because for measuring for the brace, you would measure from the head in a neutral position here to the xiphoid process, which is the base of the rib cage, the central xiphoid process there. That would be the indication of the length to set the brace for the height adjustment. And you would set up the front section under the mandible. The real section shell, it's a two-part shell, would equally have an adjustment on the rear so that you could adjust the occipital section up and down to fit snugly to the back before the clamshell itself actually goes together. In many instances, the reason for the clamshell is that the patient has a fracture, in many instances, an undisplaced fracture being the main one, and the back shell can be slid on with a team. Roll the patient slide the back shell under, then the anterior shell can be added secondary to that, rather than try to use some wraparound brace where the patient's getting distressed from that situation. So you'd normally be on a ward situation, consultant-led, with the nurses and healthcare professionals fitting the brace on a ward on bed situation, lying prone on the bed. The good point about the brace from a practitioner point of view, for myself as well, is that it comes with a full spare liner kit that goes with this. Very handy, of course, from the point of view of laundering, so that the shell liner can be ripped out on Velcro tabs, as you can see there, and these liners, all the liners throughout the brace, the chin, frontal shell, posterior, occipital pads, can all be washed on a 40-degree wash. And then you've got a spare set to utilise in the brace. Now, that is not that common in bracing within the industry, so it's a very, very good point from the use of the user that would be perhaps high in the magnitude of interest from anybody purchasing the brace. Has he got a spare liner? Because obviously when they're on a ward with a ward situation, the patient's very quickly going to soil this, because it's difficult for the patient in normal bracing. In some different types of braces that we'll be looking at, they can sometimes change the shirt up or a t-shirt underneath and actually change that. But with this level, high level, they're directly wearing this against the skin, because you can't be trying to fit t-shirts on and off and play with the patient just to try to worry about the liner. So I'll show you the fitting on the patient. We've already preset this, already stating that the adjustment by the screws here will allow this to transverse up and down as it would for the posterior section. Two screws up and down, relocating all the section holes. So you see there's a fair bit of adjustability within the brace itself. Now the brace, it comes in two sizes, a small and a regular. That would cover everybody, quite frankly. We've got myself, it fits me quite easily, so I'm 6 foot, so I think it would be 6 foot onwards, not a bother, and the small would fit any small person quite easily.